Want to welcome everybody to this Zoom seminar on polio. We've got a great program planned here this evening. My name is Eric Deneau. I'm the End Polio Now coordinator for Zone 32 East. I share that responsibility with my friend Randy. I'm the lead coordinator, and there's a few of us that work the two paired zones and support our districts as far as the efforts for polio. So in Zone 32, it's myself, and then my friend Randy. He does the western side of Zone 32. And then there's Lisa Bishop, who's in Zone 28. And a lot of credit goes to this seminar for Lisa's ambition of putting this together, which is much appreciated. And then the other person that we have with us is Jackie Hobel from Zone 32. So we have a great evening in front of us. So just housekeeping stuff, keep muted for the presentation so that we don't get any crazy feedback and background noise. We will have a period of questions and hopefully some answers at the end of the discussion. And we are recording this this seminar so that it could be shared to others in the future. Do some introductions. Introducing our Rotary International Director, Chris Etienne. Glad to have Chris with us here tonight, and she's gonna give us a warm welcome and discuss a little about her thoughts about polio. So, Chris, I turn it over to you.
Thank you, Eric. Thank you so much for the opportunity to share some thoughts with you all this evening. Great to see everyone, lots of familiar faces. I know that everybody in this meeting has a passion for our initiative of End Polio Now, and I really appreciate all of your support and you taking the time to join us for this important message tonight. You know, I think we all have our story of how we became advocates for ending polio through our Rotary International efforts. My journey is a little bit different. I joined Rotary in 1990, and frankly, I really knew very little about polio when I joined Rotary. It was Rotary that brought it to my attention. I knew that as a child I had been vaccinated for polio, but I didn't know anybody who was affected by polio or any polio victims, no one in my family. So it was really my connection to Rotary where I learned about our efforts to eradicate polio worldwide and how important it was. And I learned, first of all, through my club, and then I attended the International Convention in Indianapolis, Indiana in 1998. And that was the first time that I saw an iron lung in person. And it had a tremendous effect on me. Following that, a past district governor from my home district, Norm Veliket, 6290, had traveled on a national immunization day a few times and had gone through with a small group to Kano, Nigeria. And there were 5 of them that had done polio vaccinations in that area of Nigeria. And when they returned, they took all of their personal journals and they wrote a book. And the book was called Fulfilling Our Promise. And Norm was selling his books to raise funds for eradicating polio. So I bought one of Norm's books, and before I finished reading the book, I called him and said, I would really love the opportunity to also participate in a national immunization day. So that led to my opportunity to participate in an NID in India in 2004 and later in Nigeria in 2015. And it had a tremendous impact on me. The people who were affecting, the beneficiaries of our work, the families, the mothers, the fathers, the communities who are so grateful that we are taking upon ourselves as Rotarians our own time, our own money, our initiative to help eradicate polio in their country the same way that we've eradicated polio in North America for a long time. And the opportunity to, vaccinate a 1-week-old child, 1-week-old little girl, really had an amazing impact on me, knowing that I was having the opportunity to make a difference in her life. and witnessing the crawlers on the ground in both of those countries who were victims of polio was just really heart-wrenching. So, I just want to thank all of you for being interested enough and passionate enough to help us finish this journey that we started in the mid 80s. We all know that we had intended to finish the job many years ago, but we still have a lot of work to do, and we can do it together. And I know you all have stories to share, and I want to encourage you to share your stories to help impress upon others the importance that we finish the job of eradicating polio. And I'm a strong advocate of our opportunity for our clubs to not only raise money in their communities, but to create awareness in their communities so that people, not just Rotarians, but people that live in our communities who may not be affiliated directly with Rotary, know the work that we're doing. And those fundraisers, pedaling for polio, pints for polio, there's so many creative ways to raise money. Purple Pinky Day, jump for polio. We even have skydivers out there who are willing to jump for polio to help raise money and create awareness in our communities. So thank you to all of you for everything that you're doing to spread the word and help us finish the job so that we can eradicate the second disease from the world next to smallpox. We will do it. We are this close. We will do it. And I know, thankfully, we've got past Vice President Mike McGovern, past Trustee Mike McGovern with us tonight, there's nobody more closer to the work that we're doing who will give us a great update. So thank you again to Eric and his team and all of you. Great to be with you tonight. Thank you.
Chris, thanks for being here. Thanks for inspiring us all and bringing us all together at the zone level for these kind of Zooms. You make it so easy for us to really push this message out. And so we just give thanks for everything you're doing on our behalf here at the zone and in all our districts. So thank you, Chris.
You're good.
It is truly an honor to be introducing Michael McGovern, who is our keynote speaker. Michael McGovern has served as the chair of Rotary International's Polio Plus Committee since October 2014. In this role, he is a volunteer leader in Rotary's largest humanitarian project, the global eradication of polio. Rotary is spearheading partner of the Global Polio Eradication Initiative and has donated $2 billion to ending polio, and has worked with our partners to reduce the number of polio endemic countries from 125 in 1988 to 2 today. Mike also represents us on the Rotary Polio Oversight Board. How did he get started? Well, he joined Rotary in 1986 as a member of the Rotary Club of South Portland, Cape Elizabeth, Maine, USA. He served as club president, like many of us, district governor, foundation chair, council on legislation, a trustee and vice chair of the Rotary Foundation, and director and vice president of Rotary International. He began serving as the global chair of the Rotary Leadership Institute in July of 2020. He is a major donor of the Rotary and a recipient of the Rotary Foundation's Citation for Meritorious Service. He has also served on regional boards for the United Way and the American Red Cross. We are also delighted this evening to have past RI Vice President Valerie Wafer, who has joined us as well, and we are quite delighted. I don't have a formal introduction. She is also serving as Global End Polio Grants Chair. Please join me in providing a warm welcome to Mike McGovern and Valerie Wafer, because I think she'll take a few questions. Thank you, everyone.
Yeah, thank you very much, Lisa, and good to be with you all. And Chris, thanks for joining as well. First I want to thank the organizers for this event for scheduling at a good time. Nothing against the folks in Alberta, but they scheduled me on Saturday night during Game 7 of the World Series. And right at and I had my phone in hand, and I'm looking at the scores, and they had some guy that a band there playing like a trumpet or something, and every so often they'd interrupt the proceedings to announce the new score. And I think the call ended at 11 o'clock my time. And, sadly, Toronto was ahead then. It was good that they were ahead, but sadly, they weren't ahead at the end of the game, the 11th inning. But anyway, so it's good to be with you. And again, thank you for the organizers. Yeah, I was born almost 70 years ago. It'll be 70 years in March. And just before, my parents were fortunate. I was born just a couple of years after Jonas Salk had come up with the first polio vaccine. And Patrick Eakes, who's one of the directors of Rotary International, invited me a year ago to the Institute in Pittsburgh. Stephanie Yurchik was the the president then. And we also, it was a great institute. We also had Peter Salk, Jonas Salk's son. So it was just fascinating. But, shortly after I was born, I went to an elementary school in Portland, Maine. And I don't know if your school had show and tell, but we used to have show and tell that once a week someone would bring something, that would, that they were interested in talking about. It was a good experience, I suppose, doing public speaking even at the age of 5 or 6. But anyway, one of the things at that conference, the institute, they actually gave us gifts. And I have it here. I don't know if you can see it, but it's a bottle. Nothing that remarkable about it, except for the fact this was a bottle from Jonas Salk's laboratory when he did his research in Pittsburgh. And, out of all the things I own, and you can sort of maybe see in back of me, I get a lot of stuff. This is the one I value the most. It's the roots of polio eradication. It was this research that eventually led to Rotary taking on the project of polio eradication. And it was, that research that in Canada and the United States and so many other places that first help us to make us polio-free countries. So that's the end of my show and tell. But I am going to show a PowerPoint, which they've been kind enough to let me do. A lot of folks ask where I'm from, and this is about 2 miles from my home. It's on the coast of Maine, and the wind is howling. I would not want to be at that exact spot tonight. So I have my End Polio Now hoodie on, and it's warm, and that's good. So some of you have seen this slide before. Our goal is to get polio done, no question, to get rid of the wild polio virus and also something called polio variant cases. But to reach that end within Rotary, what we need to do is we really need to engage everyone around the world. I've been on calls recently with all of the polio coordinators for all of the African countries. We have national chairs in a lot of those places for the advocates around the world. And then with the End Polio Now coordinators, once a quarter, I think it is. And with so many, and it's that engagement, all the activities that everyone did during October in particular, and still doing, and also donating. Thank you all for donating. It doesn't happen unless Rotarians step forward to do this. Secondly, we need to focus our efforts in the high-risk areas. And I have a couple of slides that explains that a little bit further. We need accountability. Accountability includes when we're making the investments, we need to make sure that it's getting done. And finally, advocacy for polio funding, and you'll see a slide that shows the different spots. Some of you have seen this before. I love this slide. The man in the middle with the End Polio Now tie is Francesco Arezzo. He's the president of Rotary International. And this was in Islamabad in August. It was the first actually visit he made other than to Evanston as president of Rotary. And, some of he came on rather unexpectedly to be president on short notice. And this was on a Sunday. And I asked him, how his dental practice, he's a dentist, was still working. And he said he'd had a patient in the chair on Thursday, like 3 days before. So, it really to rechannel his energies and his time to Rotary is pretty significant. But I show this picture because of the kid in the lower left corner. He's the boss. If every kid opened their mouth like this kid did, we would have had polio long ago. And obviously he was well coached by his parents in order to do that. So this is what the wild polio virus cases look like over the years. You can see there's been ups and downs. The blue is Pakistan. The orange is Afghanistan. And, right now we have a little under 40 cases worldwide of the wild polio virus. And when I speak to the heads of the polio program in Pakistan, they have they tend to, every 5 years or so, to have a peak. And as you can see, the peak is getting smaller each time, but that coincides with an election. And we just absolutely have to get this done before the next peak, because there's kids still getting virus. We've also had these polio variant cases, which are also known as circulating vaccine-derived polio. The green is the number of those cases, and you can see concurrent with COVID, we had a huge spike. We didn't, up until around 2015, 2016, we didn't even have any of these cases. And then suddenly we had this huge spike, and fortunately, those keep going down. And, all of the trends right now are fortunately heading in a positive position. But one challenge we have is the budget. While Rotary, through the 2-to-1 match, the 50 million given by Rotarians, and the fundraising that occurs by Rotary, that's about 15% of the total cost. The total budget is 1.1 million. And you can see for next year, the Polio Oversight Board just approved the budget about a month ago now, and the budget's down 300 million. It's because governments around the world, and I'll show you some numbers, aren't contributing what they once did. There's lots of reductions, and it's not just polio. It's the whole area of international assistance. So Afghanistan and Pakistan are the priorities, but this outbreak response is the largest number, actually, and that's taking care of all these polio variant cases. That that peak we saw right there. We're trying to knock that down, and we're making these investments, 400 million this past year. And for Rotary too, we spend more money on outbreak response now than we do any. And Valerie can help to fill you in on that. But it's not going to be easy. But by focusing on the high risk areas, and we had a study done called Value of Money. Little things like, we're not going to do as many follow-up days. So, it's crucial that they get it done right the first time. So where does all the money come from? Well, obviously it comes from Rotarians, but you look at this chart and you'll see that this is since 2012. And don't ask me why I started that year. I think it was the most meaningful information. And you can see Canada has been, in 2012, they gave 41 million. This is US dollars. And in 24, they gave 40 million. Next year, their pledge is 151 million Canadian over the next 3 years. But I hesitate to point out, but I will. I think that's about 35 million, instead of the 40 million. But it's still very generous. It was announced that Chris was there and others were there at the Institute a year ago in Toronto. But you see, Gates is the #1 giver. The United States government is second, and that money for 25 was also 265 million. And the appropriations committees of the U.S. Congress and both the House and the Senate have recommended level funding for next year. It's not going to be easy operationalizing those monies, because none of it will be able to be spent at World Health Organization, through the World Health Organization. So we're actually arranging a meeting, I expect to hear in the next day or two, with the State Department, who's taking over the USAID. But you look at the United Kingdom, for instance, they were $63 million in 2012. And you read across it, they were up to the next year $178 million. In 2021, they were down to $7 million. Now they're 18 million. So you look, that's impactful. Germany's been gone up a little. European Commission, some of that is some tricky math for 2024. There's a loan guarantee from the Gates Foundation, very complicated. But these are the top givers who help to keep it all going. And a lot of the reduction for next year is because of nervousness of different places making pledges. A new one in 2025 was Saudi Arabia, and they have made a pledge of $500 million or $100 million over the next each year over the next 5 years. In the first week of December, the end of the week, actually the second week, it's on the 8th, there's going to be what they call a pledging moment in Abu Dhabi. And it's expected the United Arab Emirates will be making an additional commitment. You see the Crown Prince of Abu Dhabi here. 24 million. Their pledge runs out. So there's going to be an event there. And, they've also announced Rotary to announce, a new agreement with the Gates Foundation that continues to 2029. So, where's the money been spent over the years? You can see, not surprising because the money's been in recent years when things are more expensive. The number two places are Pakistan and Afghanistan. Nigeria, we're still spending money there. And then WHO Afro was the African region of the World Health Organization. India, we don't spend any money there anymore. It's all self-funded within country, which is good. And then UNICEF and WHO, a lot of that is for actually outbreak response, because we give them the monies and they allocate it wherever there is an outbreak. Sudan's an issue and the DR Congo is an issue. This picture, some of you have seen it, and you see Chris Etienne. Do you see her? She's front and center in the lower left, and some of you are also in the picture. Look around. This was taken, I think, in Winnipeg. Is that right, Chris?
Yes, in Winnipeg. Yep,
yes.
last month.
Winnipeg.
Yep.
They took this picture. That the man front and center in the back, or actually under the word Rotary, is Yinka Babiola. He's going to be the president of Rotary this coming year. But it was good to see the support there. Bob Scott's up in the far left. He's an earlier polio coordinator from Coburg in Ontario. And the picture of the gentleman in the back, he's someone that lost his life. Where he was working, there was a motorcyclist came by with a gun and shot him dead, injured his brother. I've met the brother. And, I just think, we're asked to give money, we're asked to advocate, we're asked to do different things, but it doesn't compare to what that one family has done, advocate for polio. And Jessie Harmon's on the right. I think the picture is, a photo prepared one, but she actually did climb to the Mount Everest base camp. This past year. There's going to be an article in the Rotary magazine about that shortly. But there's so many individuals, Pints for Polio, skydiving or parachuting, whatever Chris said. I can remember being, I think we were in Montreal. We all jumped in a pool at one point for polio. I don't know if any of you were at that institute, but there's so many things going on. In Australia, they just went to every train station in Sydney, and I think there's like 300 of them. And they had little buckets asking people to donate, and they raised tens of thousands of dollars, as well as they're all wearing swag, like in the lower left picture there. And it really created a lot of awareness and financial contributions as well. So one of our big roles is fundraising. The goal, I think all of you aware, is 50 million. It's actually, in my introduction said it was a little old, that we'd done 2 million. Valerie's committee just recommended a tranche of $50 million, and that has now put us over $3 billion. It was mentioned $2 billion in the introduction, but it's now $3 billion. The Gates has now agreed to, the foundation now agreed to match through 2029, and we mentioned big amounts, but it's the last dollar in is the dollar that's being spent that is going to make sure this gets done. And with 40,000 clubs, you can figure it out. It's a little over average of 1,000 per club. Worldwide, in order to meet the 50 million goal. But some clubs do a lot more than that. Some don't do any. We also have districts giving district designated funds, which is hugely important as well. So these are a couple of slides over the last couple of months, and up on the left, that's President Francesco again. The woman in the middle is Senator Aisha Raza Farouk. She is the head of the polio program in Pakistan. Wonderful person. And fortunately, she's accepted, we hope she's able to make it, an invitation to join us in Taipei. And she'll be given the primary polio talk. If you have a chance to meet her, she's a delightful person, extremely skilled and talented and just wonderful. The picture next to that is actually in Peshawar, Pakistan. And this was taken, I think, in July. And, in that picture, you see, a number of people, including the The Chris Elias, who's the person we work with at the Gates Foundation, arranges the match. Aziz Memon is in the picture. The head of the UNICEF program in Pakistan, the head of the WHO program. Over on the left of the picture, the guy named Hamid Jaffrey. He did his residency at Dartmouth Hitchcock Hospital in Zone 32, but he's retiring in the next couple of weeks. He was the global head of the polio program, which is a wonderful person. Some of you may have seen him speak at a couple of Rotary conventions. The bottom two pictures just amazing. This was within the last 10 days. And this is in Nangarhar in Afghanistan. And, we often think of Afghanistan, do they really go out? Do they do different things? The picture on the right, they're all women. And, I have other pictures that show them, but, out of respect to, their traditions, I'm not showing any faces. But we rely on these frontline workers, and these are all frontline workers in Nangarhar. The one on the left, they seat the men and the women in a different spots. But this was an outside rally for ending polio. And it was organized by the Afghani National Polio Plus Committee. And the crowd there was like 5 times the size of what you see in this photo. So, it's just amazing the dedication they have. Members of the local government come and support it. But unfortunately, we had some challenges in Afghanistan. They're doing what they call site-to-site vaccinations now, which means outside every 5 houses, they yell and make noise, and people know that they're going to be there. They're not allowed to knock on the doors. But interestingly enough, it's been pretty effective. Also, this past week, the one on the left, some of you might recognize Governor Ramesh. He was on Roosevelt Island in New York. And the woman in the pink, she's the head of UNICEF worldwide. And there are a number of other individuals here. The woman who's Rose Cardelli, who's our representative to UNICEF New York. But that's the East River in the background, and they had a big event there. On the right was a concert in Lucerne, Switzerland, a week ago Sunday. And I had frequent flyer miles, so I was able to go. And it was just a wonderful event. 1,600 tickets they sold. And they made about 60,000 US for polio eradication. And there was a check presentation. Chris's counterpart, Christina, was on stage and accepted the check. And Holger was supposed to be there with a Hoganak, but last minute he was unable to go. But it just, shows the dedication of Rotary. And the picture on the left was a vaccination event. It was back in February, actually. And the man with the blue that you really can't see in polio now, sort of in the center of the picture, but that's Yinka, the president-elect of Rotary. He's been very active in the polio program, but they probably immunized several hundred kids that day. And again, because of privacy rules, I'm not showing the kids directly, but just wonderful to see those activities. So anyway, this slide is new today. All the data is from 2023. And on the left, it shows the countries where kids aren't getting vaccinated to the degree they need to. The worst 2 countries are the Central African Republic, Papua New Guinea, and Yemen, 3. And Somalia is pretty close behind. Where are we having cases of the vaccine-derived polio? It's where the kids aren't getting vaccinated. It's a no-brainer. And you see these places. Haiti, thank goodness people aren't going to Haiti, spreading the virus there, because they have terrible immunization rates in Haiti. And if any of you do other Rotary projects in Haiti, I encourage you to use the opportunity to meet with the health officials and others there. I know Marcelo Hake, who was a member of the International Polio Committee, he's been tremendously concerned about that. And you can see Sudan is a big problem. Yemen, we haven't had cases, but again, if we get more vaccine-derived cases, these are the areas we're going to be. Conversely, the second column are the countries that have the best records. Every one of these countries, some of them are small, but they're immunizing 99% of their kids. You see Iran, 99%. A lot of people worry about that particular country. Then you go to the right, and these are just ones I chose because, one, I thought they may be of interest, and two, they're important. Canada, 92% of the kids. And, Canada, you get IPV, the inactivated polio shot in the arm. The United Kingdom's 92, the US is 93. And, even though, we had a vaccine-derived case here, a couple of years back, it's why the vaccine hesitancy is important, because, you got about 7% of the people who are exposed because their kids aren't getting vaccinated for polio. Malawi, interestingly enough, I think that was because we had a case in Malawi, in 22, I believe. There was a big drive to Iraq. You look at all the challenges in Iraq, 91%. India, they only use the inactivated polio vaccine now, the shot. They're doing well. Palestine, including Gaza, they were vaccinating their kids when they had the vaccine drive a couple months ago. It was very successful. And then you get Pakistan and Afghanistan. Afghanistan, it's parts of the country are close to 100%, but there's a couple of areas, including where those pictures were, is where we have problems. And it's where the local governments aren't as cooperative. And Pakistan, it's the same issue. Most of the country is pretty close to 100%, but Pakistan has some areas that aren't so good. This is where the recent polio cases are. And I apologize, this is a week old. I didn't update it after the numbers last Thursday, but you can see, and you look back of where you look back at this slide, you see Yemen, you see Somalia, you see Papua New Guinea, and you look Yemen, Ethiopia, Pakistan. These are both types of polio, both the wild polio virus cases and the vaccine-derived cases. And you look at Guinea. Guinea was on the other list. So you can see why we need to focus on the areas we need to focus on. The second chart is the last 6 months. The first chart on the left is the last 12 months. You look, we went from 357 cases of all types over the last 12 months, but only 76 over the last 6 months. And the high season, they explained to me there's a high season, low season. It's just about over. So we're a little nervous about Yemen. There's been some reporting issues, but for the most of these countries, we're pretty confident if there's cases, we're hearing about them. We have a pretty good surveillance system. So I want to finish with this slide. This is a picture of James Bomar. He was the president of Rotary International in 1979. He went to Makati in the Philippines and gave what we recognize before 85. Rotary really began before partners began to join us. Began the effort in 79 when they applied for a grant to the Rotary Foundation. And what's interesting is I've been in contact with Reggie Nolito, who's the current district governor. And the woman in the middle, she is the mother of the very first girl that was vaccinated, the president's vaccinated. She showed up in the last year at the Rotary office in Makati. She still lives, which is right in the neighborhood where this took place. And they now know who she is. They now know her daughter, the name. And at some point, it hasn't been arranged yet, and they might be shy or whatever. But I would just love to meet that woman. The one getting vaccinated, that was 79. She's probably about 3 then. So she's about 50 now. And the two, you think about that, and we've saved over 20 million kids from getting polio. The first one really Rotary saved was this child here. So, this is the beginning. The end is coming. It sounds like apocalyptic, but the end of polio is coming, and and that's all because of the generosity of Rotarians, your continued support, and with Valerie's help and others, we're going to continue to do all we can to ensure that we get it done. But again, it's your engagement, your activity, your leadership that will ensure a polio-free world. So thank you all.
Thank you, Mike. It's I've heard you speak, numerous times, and every time I listen to you, I always pick up some additional information, and the way you present it is easy to absorb and to get the message of where we're going and where we've been. And so I appreciate your time, and I know you do a lot of these, and it always sounds very sincere and heartfelt when you present. So at this time, we had some time for some questions for Mike or Chris or Valerie if she's willing to talk about questions you might have. So if anybody has any questions, you can either raise your hand or put the question in the chat. Um, and
I'll start. There hasn't been a question yet.
Okay, go ahead, Lisa.
Can we hear more about surveillance and what that means? I think it's a delicate subject, so that Rotarians know what is being done with their Polio Plus. What is the added feature of the surveillance worldwide? Whoever can take that, please.
Thanks, Lisa. Surveillance is not spying. Surveillance is a parent willingly takes a child to a local health officer, a local clinic, a hospital, their own doctor, whatever. And under the World Health Association records, if a kid comes in with some sort of paralysis, they are required to send to a laboratory, the place where they identify the case, a fecal sample of, from usually it's a child, from the child, and then it gets tested. There's 165 labs that the Global Polio Eradication Initiative funds, including Rotary, and they do the testing there. And so the surveillance, in these labs, that they're also, testing for other diseases as well, which is the Polio Plus. They're not limited to just polio, but that's what surveillance is. It's identifying the cases, and without adequate surveillance, you have no idea what's out there. And it's why we're concerned about Yemen, because they didn't do a good job for getting it out. So I see Marlene's apologizing for the late presentation. It was late, but they did a good job and it was entertaining. So Marlene, you're good to rejoin us again on having to listen to me 2 out of 3 nights. So anyway, does that adequately answer the question, Lisa?
It does. I also have a supplementary question around surveillance and monitoring major cities and sewage. I think because I don't know if a lot of people realize the presence of wild polio within sewage, within communities that may not be very far from where they live.
Thank you for prompting me. I should have mentioned that surveillance is, taking the kid to the lab. The other thing is doing environmental testing. Right. And what they do is they take samples out of creeks, out of brooks, out of rivers, including, they took it out of the East River and the Hudson River in New York. And after that case in Rockland County, they actually found polio in those places. We have the most extensive system of environmental testing we've ever done. In Pakistan alone, I think there's 150 sites where they pick up samples and send them to the labs. And we had seen an uptick in positive environmental samples, but because of the immunity levels, and they've done a good job, is we're not seeing the cases. But it is a concern, but it's a crucial part of the program. And we not only do that in Pakistan, we do it in Afghanistan, and we do it in most of the African countries. And even, locally in some of the communities there's not an organized system of doing it, but some of the communities on their own do it just as they have with COVID to figure out whether or not COVID is in the region. But they've also tested for polio.
So, Mike, I got a question out of the chat. Remy Pervato, is it known what the link is between COVID and the vaccine-derived polio?
The only link is during COVID, people weren't getting vaccines for other things. And as a result, the kids' immunity level wasn't high. And as a result, they were more susceptible, which is why we had that peak. It had nothing to do directly with COVID. It was the fact because of, if those of us that we all lived through that period, life wasn't the same. And part of it was there was a pause in vaccinations. And, through the leadership of Gavi, UNICEF, and WHO, we've had a program oddly titled The Big Catch Up. It's not a Heinz bottle, but they call it The Big Catch Up. And, so there's been a really big focus. And, one reason that the budget went up last year is there's been a really big focus on, making sure that those kids that might not have been vaccinated 5 years ago, those in the age of 6, 7, 8, 9, that those kids are now being vaccinated.
Can you, stress the importance of the healthcare workers, the people that are, the boots on the ground, the ones that are out there doing these, immunizations, giving the vaccines, and what challenges they have, and
Yeah.
the real hazards to some of them.
You know, they're the frontline workers in every respect. They're out there in the field. They're out there in bad weather. They're out there in security compromised areas. In Pakistan and Afghanistan, everywhere they work, we have to have security with them. In Pakistan, it's provided by the army. And when Francesco was in, President Francesco was in Pakistan, he met with the head of the army because of their crucial importance for security. We've also over the course of ending polio, we've probably lost about 150 workers over the years. In fact, Francesco, I know, is trying to pin down that number because he was so struck when he saw the pictures of so many of them in the emergency operating center in Islamabad. But yeah, and that's I don't want to, Valerie, when she reviews the grants, she in the committee, she's on the committee along with Pearl from Nigeria and Aziz from Pakistan. The number one really piece that stands out in the budget is we pay the stipends of those frontline workers. And last year, we paid for the stipends of over 500,000 frontline workers. They're on, short term. They're, paid on a per diem basis, and it's really amazing. But their courage, their dedication. When I was in Peshawar back in July, which again is the ground zero, that area for cases, I asked. We met with some polio workers, frontline workers, and I asked them, did they feel secure? And it was interesting. These were, very professional individuals. What one of the ones I was talking to, she had actually been a nurse once, and had some family issues, and she was no longer a nurse, so she was a polio, frontline worker, not making much money. But she gave the answer, and she didn't even talk about security as I see it. It was, whether or not, they felt, safe from falls and that sort of thing. It was the environment more than it was, what we generally think and the problems we've seen. So, yeah.
So this question for Valerie, if she's is the grant process, and what her team and what her role is in funding these grants, and how they're looked into.
Thanks, Eric. I joined as a participant tonight, so thanks. I'm happy to answer the question.
That's okay. I mean,
no, like you, I learn something new every time I listen to Mike speak. So that's why I'm here. And he's also in our zones. So, I'm here to support all of you and the incredible work that you all do. So I have the honor of being on the International Polio Plus Committee and the chair of the Grants Committee. And, we all know that every year our role is to raise $50 million, and that is met by the Gates Foundation. And that's where the $150 million budget comes that the trustees do approve. That money goes to our two partners, right? It goes to WHO and it goes to UNICEF. And that's part of our agreement with the Gates Foundation, that those are the two agencies that we support. And so the money funds, 5 key areas. It funds surveillance, social mobilization. We talked about surveillance already. Social mobilization is so important. As Mike mentioned, in Afghanistan, the women healthcare workers and men also cannot go house to house. So we need to pull them out of the house. And so that social mobilization is so important to let them know that it is the campaign happening, and they need to be aware that it's time to bring the children out to be immunized. Also, social mobilization supports a lot of misinformation, a lot of the vaccine hesitancy, and a lot of the education component also falls under there. Operational support, Mike talked about the frontline workers, the stipend that we give, and everything that has to happen on the ground, which is what we support. Also, UNICEF is the ones who actually procure the vaccines. So the money goes to procuring vaccines. And then again, it's been talked about outbreak response. So when we have an outbreak, putting the resources where they're needed, when they're needed, to make sure that we mitigate any effects of that outbreak response. So that's where the money goes. And in September, I had the opportunity to go to Geneva to WHO's offices, and sat through 2 incredible intensive days of meetings where we looked at what the global situation was at that time, where the cases were, some of the challenges, some of the successes, how we were going to deal with the budget cutbacks that are inevitable because of the funding redistributions in governments around the world, and finding those efficiencies. And also they explained, because we provide them with the grants, their stewardship of the money that we give them. They have to account for every single dollar of every grant that they apply for, and they outline where the money was spent and how it was successful, and where some of the challenges are for the future. So there are people on the ground, right? We're the advocates, we're the fundraisers, we're the education component, but they're doing the work on the ground. And this is where our money goes. So for me, it was my first time sitting through those meetings, and it was a real comfort and an eye-opener that I think we can all be very proud that the money we raise is being used very efficiently and in the right place. And as I said, with the cutbacks, there will be some efficiencies that need to be met, some risk mitigation to just make sure that we are where we need to be. And I'll just mention that tomorrow I'm heading to Ottawa. So our Canadian advocates are meeting in Ottawa with all parties in a reception on Wednesday evening. And hopefully they're in a good mood, because Tuesday's budget day. So it will be interesting. But we're not asking for money this time. We are simply keeping that relationship going. But as Mike mentioned, we were on a meeting recently with our advocates around the world, and 2027 is going to be a tough year for all of us to keep asking for money from all of our governments. So everything that you can do to engage with your local politicians of every party is so important. Your advocacy is so important right now. So I hope I answered the question about how the money's spent, and maybe reassure you all that you can reassure your donors and your clubs and your districts that the money is spent very wisely.
Great. Thank you. Thank you, Valerie. Appreciate you hopping in and answering a question. So another question that's in the chat is progress on the manufacturing of the distribution of the NOPV and the novel oral polio vaccine.
Mike?
Yeah, thank you. The NOPV is the novel or new oral polio vaccine. It's a more stable one. It's expected to have less impact with the vaccine-derived cases. Most of the NOPV is manufactured by a company called Biopharma. It's in Indonesia. It's a good company, and also it's manufactured in a country that's predominantly Muslim, which is important for the trust of the vaccine by folks. Another major manufacturer is in India, and we don't use any of the Indian vaccine in Afghanistan or Pakistan because of local sensibilities. When it first came out, there were some issues with it wasn't in enough supply. Now it is. Our vaccine supplies are in our projections show that we're all set through the end of 2026. And we'll look at it again later, but that's all going well. And there has been a second company that's been certified now to provide NOPV. They were just quickly, I know we're running out of time. There was a question on do we have statistics on which ethnic group is impacted more? Specifically, no. But we do know, most of where we're working is Muslim countries, but there's also Christians, there's others in those countries, so I think for the most part it's evenly divided to the degree that the population's divided. With one exception, we do have issues with the Pashtun community in southern Khyber Pakhtunkhwa in my pronunciation, but in Pakistan. There are some Pashtun leaders that aren't as supportive. So when we talk about one of the Rotary priorities of working in high priority areas, a lot of that is working with UNICEF and make sure with the Pashtun leaders that we're getting them to help out. So, and there was another question about whether or not people really know about the polio initiative. I think if you ask 100 Rotarians if they've heard of the Global Polio Eradication Initiative, GPEI, or if you just ask them what the initial GPEI stand for, I think very few would know. But they do know that Rotary is working on it prominently. I want to say, and I can't speak for Canada, but in the US, there was a survey done a few months ago, and they asked if the US government should spend more on polio vaccinations, the same or less. And less was only 6%. So, they may not know the bureaucracy, they may not know all the ins and outs, but, despite what you read about, Robert F. Kennedy Jr. and the anti-vaccine crowd and all the rest of it, the reality is that, Donald Trump calls this an amazing vaccine. And, it is. Thankfully, even though, there are challenges with operationalizing some of the money, the American public, and I think the Canadian public, you look back at the numbers of kids being immunized, understand the importance of vaccinations.
Yeah, thank you, Mike. I just want to thank everybody. I want to thank Mike. I want to thank Director Chris and Valerie for helping out on this call and having this wonderful conversation. My message to everybody as we leave this, we're kind of we're talking to the ones that are we know about this. And as Lisa likes to say, we need a call to action. So when you attend a seminar like this, there needs to be an action and a result from. So I would encourage you all to talk, within your clubs, to other Rotarians, and even to your community to, talk about what Rotary is doing in these efforts to eradicate polio from the face of the earth. So take the message and take the knowledge that you learned here tonight and please share it with others. And I appreciate your attendance tonight at this seminar on polio. So thank you so much. And I appreciate everything, what everybody does. Thank you very much.